Good morning, ladies and gentlemen. I'm Fausta, a doctorate nursing student from SPUP, St. Paul University of the Philippines. Now, with Vivi Retno interning, I'm going to present my study entitled Assessment of Loneliness Among the Elderly in Selected Region in Indonesia, Basis for Mental Health Awareness Development Program. As is known from world data according to WHO, the elderly population is increasing and it is estimated that by 2025 they will become baby boomers. Many developed and developing countries have a larger number of elderly people, such as Indonesia, Japan, China, India, and also United States. That is according to Rosvita et al. 2023. Of course, problems are also caused by such population conditions. Likewise, in Indonesia, the elderly population is increasing and by 2023 reached to 11.75%, and most of them are female, 52.28%, and majority of the elderly is the young elderly category, 59%. It means they are 60 to 69 years old. That's according to Indonesia's Central Statistic Agency 2023. Loneliness is a mental health problem in several countries in the world, including Indonesia. Several previous studies have shown that loneliness is a significant mental health problem, especially in the elderly, which also shows that the elderly are very at risk of experiencing loneliness problem for various reasons, including living alone, far from their children and grandchildren, as well as close people who care for them. So appropriate program designs are needed to increase awareness regarding mental health. Loneliness in the elderly needs to be studied as an anticipation for mental health nursing intervention. Based on this situation, my objective study to assess the level of loneliness among the elderly and propose a mental health awareness program to mitigate loneliness. For the methodology, these study designs use descriptive analytic approach. And the participants, we assessing 257 elderly respondents from Yogyakarta, Central Java, and Palembang, south of Sumatra. And we use tools to assessing the loneliness level using UCLA Loneliness Scale version 3 with 20 statement items has been filled in by the elderly based on the conditions and situations felt. This instrument has been used previously in Indonesia setting by Elisa et al. 2023, which modifies the loneliness assessment instrument from UCLA that Sanjaya and Rusdi has translated. So it can be used to assess loneliness among the elderly in Indonesia. Finding of this research, participants' demographic profile. By the age, most of the respondents are elderly, around 60 to 74 years old. That is 69.9%. And by gender, most of them are female, 57.2%. By origin, most of them are Javanese, 80.2%. And by religion, most of them Christian, 59.9%. By civil status, they are married, 64.6%. By educational background, most of them have higher educational background, 48.6%. And by significant others, meaning they are living with their couple or their relative, 58.8%. And by social economic status, they are in the lower level of social economy, 44%. And the level of loneliness among respondents, most of them are in the low level of loneliness, 30.7%, followed by moderate high, 30%, and then moderate, 21.8%, and lastly, high degree of loneliness level, 17.5%. For the proposed mental health awareness program, with goal, promote social engagement and mental wellness among elderly, with tool mental health intervention to support elderly individuals experiencing loneliness. And for the implementation, should be conducted by nurses as preventive and therapeutic program, and it can be applied in both community and hospital settings. This research concludes that loneliness in the elderly in Indonesia is important and requires attention so that interventions can be carried out effectively, especially community-based mental health programs, which are recommended to reduce its impact. That's all my presentation. Thank you.